When we have a patient, usually it'll be a diagnostic patient, so someone either came in with a lump or they came back after a screening that we detected something. We'll sit down, we'll go over the results with them. Again, most of the time we're not 100% sure it's going to be cancer, and so sort of depending on how concerned I am about it, I convey that level of concern to the patient, talk to them about the next step for their treatment, and try to sort of encourage them that this is the reason we're doing mammograms, is to find cancer. Try to give as much of a positive sort of, now we found something. The next step is to, find out for sure what it is and then get you in for treatment. So I try to kind of give them this, sense that we're moving forward with a plan. And I always encourage them, get educated. The best thing they can do to help themselves is find out as much as you can. Fortunately and unfortunately, breast cancer is so common that there's tons of information they can get. Good sources can be found on the internet. The American Cancer Society has lots of information. The government has a site, with lots of information. So, and then I sort of encourage them to sort of write down questions. So when they go for their appointment, when you're so nervous that sometimes you don't remember to ask the questions that you have. So I, suggest they write them down. Maybe usually they're going to take somebody with them, a family member or a close friend, so that person can be listening too, because when you're talking about having cancer of any type, people are anxious, they're nervous, they're worried. So a lot of times the first time they're talking to a doctor, they're really not hearing what's being said. So again, good to write down questions, have someone with you, and the more you know, hopefully the more comfortable you're going to feel about what's going on, and better chance you have too if you don't like what you're hearing, then there's always a chance of getting a second opinion. But the more they know, the better off they're going to be.